Good evening and welcome to 60 Minutes. Every 10 minutes in Australia, somebody suffers a stroke. It's our second biggest killer and has left nearly 500,000 survivors living with crippling disability. But despite the dramatic medical advances in other fields, there's only so much that can be done for a stroke patient, which makes the work of one clinic in America so tantalising. Its results have to be seen to be believed. The therapy is controversial and heavily criticised, but the patients say it's truly miraculous.
Can you please count from 1 to 10?
Every minute of Linda Lumbra's daily life is a frustrating struggle.
1, 2.
She suffered a stroke 3 years ago, which left this teacher barely able to walk or talk.
4, 5.
Doctors have told her this is how she'll be forever. That's why Linda's travelled to this Florida clinic to try a controversial new stroke treatment.
Well, I can understand why you would. The speech makes it very frustrating.
It's her last shot. One injection of a drug called Etanercept into her spinal cord at the back of the neck.
What's different?
A brief few minutes pass to let the drug flow to her brain.
Clear.
Clear. Okay.
And not even Linda or the doctors here expect what happens next.
Okay, did it look cloudy? Okay, now it's clear?
Oh my eye.
It was a bullseye hit on the pathology that was interfering with her brain function.
Yeah, you're doing fine. You're doing super fine.
Using Etanercept in this way on stroke patients is groundbreaking.
So crisp.
1, 2.
The conventional and approved use of Etanercept is for the treatment of severe arthritis.
Can you bring it up?
But Dr. Ed Tobinick has 700 stroke patients who've received this treatment at his Florida clinic.
Little stick.
An anti-inflammatory, it attacks or blocks the build-up in the brain of a molecule called TNF, or tumour necrosis factor.
In stroke, what happens is there's an inflammatory response, a chronic inflammatory response that is caused by the stroke. Etanercept works by neutralizing that chemical, TNF, thereby improving the ability of brain areas to communicate with each other.
Hi, Charlie. Nice to see you. I'm going to give you a few words to repeat.
We featured Dr. Tobinick on 60 Minutes in 2011.
And can you tell me who is the U.S. president?
When he used the same drug, injected the same way, on Alzheimer's patients.
Charlie, who is the President of the United States?
Obama.
Yes.
Dr. Tobinick now claims his unorthodox treatment can aid stroke recovery.
Okay, you'll feel a little stick just for a second.
We see improvements in cognition. We see improvements in motor function. We see improvements in spasticity. We see improvements in pain.
617 stroke pieces.
It's those improvements that 52-year-old Linda Lumbra and husband Benny have been searching for. How would you describe your wife before this happened?
Oh, very outgoing, people person. Loved to chat with people and visit and, you know, help people also.
Linda collapsed while teaching in her classroom in late 2010. It was a massive stroke following an epileptic seizure. She lost virtually all speech, and Linda's left side fell limp and numb.
Touch your nose.
Traditional stroke therapy could only do so much. And after 6 months in rehabilitation, Linda was sent home. This must have been heartbreaking, watching your wife become this. And the incredible moment.
Hi.
Hello there.
Linda wakes up.
Woohoo! It worked.
Welcome back to 60 Minutes and the extraordinary new stroke therapy transforming lives. When Linda Lumborough suffered a stroke 3 years ago, she lost her speech and struggled to walk. And like so many stroke victims, rehabilitation could only do so much. But then she heard about a controversial injection that was reducing the effects of stroke. It isn't fully tested and is viewed cynically by many neurologists. But that hasn't stopped Linda, and the results are something to see.
What's different?
It's only been a brief few minutes since Linda Lumborough received that injection of Etanercept at the base of her brain.
Clear.
Clear.
She's been tipped upside down to allow the medicine to flow into her brain.
Oh my.
Remember, this is stroke-affected Linda just before the injection.
One, two. Oh my.
Moments after the shot, she sits up. The change in Linda is something to behold.
It's gone. Hi.
Hello there.
Woohoo! It worked. On me.
Yeah.
Oh. In here is clear. Hi. It's me.
It's truly a miracle. It happens all so quickly, and it's done. And before you know it, it's all over with, and then boom.
I can talk. I can walk.
We felt it was likely that she would improve. To improve almost back to normal was just spectacular and wonderful and gratifying and very, very moving to watch.
Hi.
How would you describe yourself before and then after the injection?
It's just truly amazing. The change is absolutely miraculous. It's amazing. Every day there seems to be something that's like, oh, I can do that now. It's amazing.